Monkeypox is a rare viral disease in both animals and humans. This infection is transmitted by the monkeypox virus, which belongs to the same family of viruses as the variola virus, causing smallpox. What's all the new uproar about? Why has it become an international concern lately? We will be talking about the monkeypox virus today in this video, so stick tight.
Welcome to Hear This. Don't forget to like, comment, and subscribe.
Monkeypox was first identified in 1958 in colonies of monkeys kept for research. Despite being named monkeypox, the source of the disease is still not known. However, its natural reservoirs are primates and rodents in Central and West Africa. These rodents and non-human primates harbor the virus and then infect people. The first human case of monkeypox was recorded in 1970 in the Democratic Republic of the Congo, in a 9-month-old boy in a region where smallpox had been eliminated 2 years before. Afterward, human cases of monkeypox had been reported in 11 African countries, including Benin, Cameroon, the Central African Republic, the Democratic Republic of the Congo, Gabon, Côte d'Ivoire, Liberia, Nigeria, the Republic of the Congo, Sierra Leone, and South Sudan. As international travel becomes more common, viruses that were once confined to certain locations spread around the world. This is why monkeypox is a disease of global public health concern, as it not only affects countries in Africa, but the rest of the world. In 2003, the first monkeypox outbreak in the United States of America led to 70 cases. It was linked to contact with infected pet prairie dogs. These dogs had been housed with Gambian pouched rats imported from Ghana. In the summer of 2021, a case of monkeypox was found in a U.S. resident who had traveled from Nigeria to the United States. Monkeypox has also been reported in travelers from Nigeria to Israel and the United Kingdom. Then, May 2022 again brought outbreaks to regions outside of Africa, including Europe, America, and Australia. The most susceptible to this infection are still children, who have had a mortality rate as high as 10% in some outbreaks. Studies are still underway to further understand the epidemiology, sources of infection, and transmission patterns. All the researchers have concluded till now is that the monkeypox virus can be transmitted to you either through an infected animal bite or through direct contact with the bodily fluids of a person suffering from the infection. Infected animals may display fever, rashes, swollen lymph nodes, eye discharge, and general restlessness. Person-to-person transmission occurs usually among family members due to direct prolonged contact. The disease usually takes between 5 and 21 days for the first symptoms to appear. These initial symptoms include fever, a headache, muscle aches, backache, swollen glands, shivering, chills, fatigue, and exhaustion. 1 to 5 days after the first symptoms, a rash appears. The rash is sometimes confused with chickenpox. It begins as several raised spots on the face, which turn into small blisters filled with fluid. This rash then spreads to other body parts, including the genitals and anus. These blisters usually form scabs which later fall off, and the disease runs its course in 2 to 4 weeks. Symptoms remain mild, and most people recover within a few weeks without treatment. But if your symptoms are more severe and you become unwell, you may need treatment in the hospital to alleviate symptoms and manage complications. You should take fluids and food to maintain adequate nutritional status. An antiviral agent known as tecaviromat, which was developed for smallpox, is licensed at the European Medicines Agency, EMA, for monkeypox in 2022. But unfortunately, it is not yet widely available. The risk of needing treatment in hospital is higher for older people, young children, and people with an incompetent immune system. Although the disease is rare, there are things you can do to reduce your chance of getting it and passing it on. Raising awareness of risk factors and educating people about the measures they can take to minimize exposure to the virus is the main prevention strategy for monkeypox. Outbreaks are prevented by isolating patients to avoid close contact and observing strict hygiene around them. Infection can also be prevented by vaccination with Jynneos, Imvanex, or Imvamune, an attenuated live virus vaccine. Inoculation with the smallpox virus can also offer a good deal of protection to people against the virus. During the period of intense smallpox vaccination in the 20th century, outbreaks of monkeypox were rare and brief. Since the eradication of smallpox and the cessation of worldwide vaccination in 1980, monkeypox outbreaks in countries such as Congo have become larger and more prolonged. Now, the National Health Service, NHS, is again offering 2 doses of smallpox vaccination to people who are most likely to be exposed to monkeypox. These include some healthcare workers, veterinarians, or people who have been in close contact with someone who has monkeypox. On a personal level, you can adopt certain measures to avoid exposure to the virus. Wash your hands with soap and water regularly, and keep an alcohol-based hand sanitizer. Stay at a distance of at least 1 meter from the people who may have monkeypox. Do not share bedding or towels with people who may have monkeypox. Be aware of the symptoms of monkeypox if you are sexually active, especially if you have new sexual partners. Talk to your sexual partners about their sexual health and any symptoms they may have. Do not go near wild or stray animals, including animals that appear unwell or are dead. Do not eat or touch meat from wild animals while traveling in the West and Central Africa. If you think a monkeypox outbreak is potentially another major global health threat, like COVID, the good news for you is we have a much greater chance of controlling monkeypox than COVID. For one, it takes much longer for a monkeypox infection to develop within an individual and to become transmissible. Therefore, there is a greater opportunity to protect contacts. Secondly, monkeypox may not be very transmissible because its visible rash highlights the need for quarantine, while COVID can be transmitted before symptoms emerge, and even in asymptomatic cases. Still, one should go with the better safe than sorry policy and take care of oneself and one's loved ones. Don't forget to comment below if you've got some recent information to share with us about monkeypox or how this video helped you.